All right, we are ready to get started. Before we jump into information from Garfield County Public Health, I want to introduce myself. I'm Amy Shipley. I am the Assistant Executive Director of Garfield County Libraries, and we're proud to partner with Garfield County Public Health on sharing this information about the coronavirus status in Garfield County. With many of our schools going to online learning, I wanted to show a couple resources for parents and students that might be helpful in this time. So give me just a second to share my screen here. So if you go to our website, gcpld.org, and browse to the research tab, and scroll down to BrainFuse. I went too far. BrainFuse is an online tutoring service that's free and open to all students. It's available from 2 o'clock to 11 o'clock every day, and you access it for free with your library card. So once you click access here, you type in your library card and you can get tutoring help, homework help, skill building. This is a great resource for parents and students to help out in this time of online learning. And that's brought to you free from the library. And then back on our resources tab on our website, if you scroll down to lynda.com, spelled with a Y, and click access, then log in with your library card number and a password you'll create when you first create your account. Then browse over library, browse over education and e-learning, and then K through 12 education. And any of those resources on any of those mouse overs is free and available with your login. There's tons of resources here for teachers, parents, and students. And again, that's free from the library. And with that, I'd like to introduce our presenters today. Please welcome Josh Williams, Environmental Health Manager for Garfield County Public Health, and Mason Hostat, Public Health Specialist with Garfield County Public Health. Mason and Josh, thank you for being here today. I know you have some information to share with us.
Yes, thank you. There were some questions that were asked before. Do you want me to go through those, or how would you like for me to start?
Yeah, I thought we could begin with your presentation, and then I'll give you those questions at the end, and there may be questions from attendees as well.
Okay, so I figured I would share some of the data that we have available. I'm going to share my screen. And so this is our Tableau page, and everybody can access this either from the Garfield County website homepage. We have Spanish up here, which people can access immediately. And basically this front page that is loaded is has our total case count, and then our cases reported in a 14-day period. As we can see, we've seen a great spike in the number of cases in recent times. No one should be surprised by that. But with this map, there is some interactivity that wasn't available before. And so if somebody were to click on Glenwood, oh, sorry, sometimes Tableau makes you, it reloads. Anyway. You can see that this over time is the number of cases in Glenwood Springs over time. If you go to Carbondale, similar situation. If you click on our 20 to 29-year-olds, you can see how they interacted over time. And then Hispanic, Latino, and are not Hispanic, Latino. And so it just gives a little more interactivity with the map, with the case data that I report every night. The other thing that we have is our metrics. And so this is kind of some of those measures and other things that we that were part of our coronameter, if you looked at this page before. And so we have those 4 factors that are tracked by our public health department, but are not factors necessarily in what the state looks at. And so those are community spread. Community spread is when a positive case does not know where they were exposed, or just doesn't have a known exposure. So most of the time, 57% of our cases know where they were exposed or were exposed in their household. The days before seeking testing, the recommendation is to get tested within 48 hours of symptom onset. So as you can see, we are above that, 3.2 days on average. Somebody is waiting to get tested before their symptoms start. Test turnaround time, that's the number of days before from the time that somebody gives a specimen before it's returned from the lab. Right now we're sitting at 3 days. And then the percent of cases interviewed. This has been something that we have seen go down recently as our cases have spiked. We have had multiple days in the past week since the 13th with 50 cases or more reported to us at one time. That report comes through the state, through the Colorado Infectious Disease Reporting System, which is just how those cases are reported to us. So on the 13th, we had 53 cases reported to us, and on the 15th, we had 50 cases reported to us. And so that it's been written up in the paper and everything, so we just haven't had the ability to do a full case interview within 24 hours. Then at the bottom, these are the 3, I'm going to show another page, but these are the 3 factors that the state looks at for openness. I know there is probably some confusion. There's confusion even with us and the way that the state handles things. So the dial that the state has created is really more about openness. What level of restrictions are in place, meaning, the percentage of people that are allowed in a restaurant or at a gym, at a house of worship, gathering size and things like that. So this is not indicative necessarily always of where a county stays or where a county is with their disease and incidence rate and everything like that. As you can see, this is why. As of last night, we had an incidence rate of 659.8. That is 338 cases reported to us over a 2-week period. This metric, the days with stable or declining hospitalizations, is also a little confusing. It doesn't mean that we have 9 people in the hospital. It means that we have had 9 days out of the last 14 days of either declining or stable hospitalizations. And then this last one is our test positivity, and that is the percentage of tests that have been conducted in Garfield County that have returned positive. And so we want to see this lower. Lower is better. And so if you scroll over this, and you can see that a little explanation comes up. All of these are translated into Spanish for our Spanish-speaking population. And it gives some idea of what we want. So we want this number to be low. We would like this number to be below 5%, and unfortunately it isn't. And so I'm going to stop sharing that. I should have just shared my entire screen because I have some more slides. So what I'm going to do that. I'm going to share my screen, and then I'm going to go to this and that. And I wanted to get to this page. So this is the COVID dial page. This is the state page where you can find where people are in regards to this dial. Purple was added this week, and that's a new level. And so we've got that to deal with. But if you mouse over our county, you can see that we are at level yellow. If you click on that, you should see those numbers. And actually, I update this information nightly, and so that's I'm usually updating this information about this time during the night. And as you can see, 713. We have an incidence rate of 713. I can calculate how many cases that is real quick. 100,000. 420. So again, and the dial is the level of openness. And I want to just go up here and show what I mean by that. Oh, you probably can't see it. It's so little. But the yellow avenue is this bar right here. So this is where we are within the level of restrictions that the state allows us to be at. I know that's probably confusing. And we're trying to do the best that we can with these multiple ideas, different ideas of what things are. And so with that, I think I will stop sharing. And that's really where we kind of stand on that with the data. And then I figured we could answer some of the questions.
Great, thank you, Mason. That was very informative. Just going to pull up my questions here so I can ask those. So the first question is, can the public be informed on actual COVID case numbers treated as inpatient in Garfield County hospitals? And they're asking for the number total since February and numbers per month.
And so I don't want to be hesitant because that information is public. And so what we have really tried to do as a public health department is look at what is our data, what is the data that we have that is our data to report on, and what are our partners' data. And so the hospitals and hospitalizations is a hospital level a piece of data, right? And so both hospitals publicly report either on their website. Valley View does, if you click on their website and go to their cumulative stats page, reports on the number of hospitalizations that they have had. And Grand River reports, they probably do have it on their website, but I go to look at it on their Facebook page, and they usually update those numbers on Tuesdays and Thursdays. And so it's not that I don't want to say that we don't have that, we do, but it's not our data to report out on. And so that's, I just want to make sure that we're clear that public health wants to report out on what is public health's data, and that information is publicly available for people.
Great, thank you, Mason. I see a couple of questions coming in from chat. I'm going to read one more question that came in via email earlier this week, and then we'll get to a couple that are in the chat.
Okay.
Where are the new infections coming from? For example, what are the contagion vectors? And so,
yeah, that's an interesting question. So the contagion vector is people. The contagion vector is an infectious or contagious person, right? And so I think what this person or what this question is trying to get at is what's changed in people's behaviors from April and May through July till now. One thing we all know, dang it, right, is we're all tired. This has been a tiring, exhausting experience. No matter who you are, no matter what city you live in, keeping yourself safe and being responsible is a tiring experience, right? So people are tired of wearing a mask. I'm tired of wearing a mask. We're inside, so I'm not wearing my mask, but I wear my mask out in public. Another thing to think about is our mobility. There is a website, Domo, that the state has utilized the metadata from our cell phones. And we have found that Garco is currently practicing like 9% social distancing. compared to about 66% when we were in April. And I've talked about this in other forums. Most of the time are during the week is when we see people not staying home. And so that makes sense, right? People have to go to work. People in our communities have to travel. You know, at least one municipality over, if not more, for their work. And so the more movement a person has, the more people that a person comes into contact with, the more likely you are to increase your risk of contracting the virus. You know, we know that the movement indoors, we were on a conversation with Dr. Deborah Birx, who is part of the federal response or the federal task force. And she said, we're kind of seeing the inverse of the South here. So the South in the summertime, it's hot in the summer in the South, so people move indoors. And so we saw an increase in cases, you know, Florida, South Carolina, Georgia, Mississippi, all of that. Well, the inverse happens here. It gets colder and people move more indoors here. We know that people are having some small gatherings. And so I want to talk about that for just a quick little second, because sometimes I think that we miss the person-centered kind of language on when we put things out about reducing your gathering sizes. What we're really trying to do, the number one thing that a person can do to lower their risk of contracting a virus, not just this virus, not just COVID-19, but any virus, is reducing the number of people that you come into contact with, especially those people that you don't know. And so when we say, or that you haven't seen for a while. So when something comes out, you know, no gatherings of 10 people, some of that messaging gets lost. But what we're really trying to say is reduce the number of people that you come into contact with, because at this point in our state, for you probably, for every 145 people that you come into contact with, you're coming into contact with at least one person who is positive and contagious. You know, we've seen outbreaks, right? And sometimes those are difficult things to handle and get containment on. We have workplaces that are not compliant with some of the public health orders, or you know, some of that, and so then somebody becomes exposed at a workplace and then takes it home. Really, our 20 to 40-year-olds not thinking that they can catch it, or I did write some of these answers out, so it's not just off the top of my head, just so everybody knows. And 51% of our cases from the past week are 20 to 49-year-olds, and so, you know, thinking that their disease severity will be, you know, that they won't have a severe disease, or that they don't necessarily have to worry about it. And so that's really, you know, some of those answers. I don't know if Josh has anything to add. No?
Oh.
No. Okay.
Okay, we have more questions. Have we heard anything back from CDPHE about changing Garco's level from yellow to orange?
Yes, this is Josh Williams, Garfield County Public Health. So we have received our letter. So we had the meeting Tuesday, the public meeting. Most people probably aware of with the state and the Board of County Commissioners, who act as the Board of Health, retain that authority. So the state did send their letter to us, and looking at their determination that they're moving us into the level orange. That would be on Friday or tomorrow at 5 p.m. And so we're currently, the commissioners are looking at their response today, and we'll be issuing that press release around that. And so yeah, you know, our plans in developing this discussion were looking at levels and what the restrictions are and capacity limits. But as we know, the discussion is a little, still a little mixed until that press release comes out. So, you know, we should be seeing that. I was a little bit distracted. I apologize, because I got a message from the director looking at that press release. So that should be going out. But so we are moving in that direction. I think looking at there's some discussion whether retaining the variances for the site specific and activity specific variances. But we're also going to have a comparative list of what yellow level restrictions are, what orange level restrictions are. So that'll be coming out here, should be either tonight or in the morning, and to get some clarification on that.
Thank you.
And
Sorry, go ahead.
just real quick on that, it is the board of, just to clarify, Board of County Commissioners have the authority to either set up a separate Board of Health or retain that duty underneath them as an existing Board of County Commissioners. So in Garfield County, the Board of County Commissioners, that's their decision, does retain that right to operate as the Board of Health and as the head of the health jurisdiction. So, as the health department, we work underneath their guidance and what their policies are, as well as we work kind of independently. The State Department of Health is a separate entity. We are fully a local entity and don't operate directly under the state. So
I think that's an important clarification. I think that's the part of the underlying question. So thank you for answering that. There are several questions about the inconsistency around testing around the state. So why does it appear to be less testing, or is there less testing available in this county compared to other local counties nearby and across the state?
Sure, and so that is, hold on just a second. I think that's good. Okay. So we don't necessarily have a decrease in testing in our county. If you look at what Valley View has put out, they have they've said that they've collected about 13,000 specimens. What I think people can see in other counties is that there might be something like a drive-through test site or something like that. Providers, we are not a public health department that provides testing. We do not offer that service. And so we are reliant upon our providers in the area to do the testing. And so it's not necessarily that we are doing less testing, it's that it's not something that the public health department does. And so,
I'll just add on to that too, is to say we are participating very heavily with our partners, and we feel that the best place to have the testing done is through our medical providers. That way there's an assessment that it's symptomatic driven as far as the guidance that we have. There are some asymptomatic testing surveillance processes that are going on with long-term care facility and some healthcare institutions. But as far as what we're following guidance on is symptomatic testing, and the best place that we feel that is done is through our medical providers. And we do feel like it's robust access in our county. We've got Valley View Hospital, we've got Grand River Hospital, we've got Mountain Family Health Clinics, as well as others that we have that list available on our website where you can access. And we did put into the state in the beginning for having potentially a local state supported testing center that's similar to what's set up in Grand Junction. But the decision of the state was to keep that in Mesa County and Grand Junction and make it a regional. So it's kind of not just serving Mesa County, it's feeding from the regional counties in the area. And that's, we have seen, like I say, our partners in Eagle, we've got the traveling bus that comes through and does some testing. But we also provide that to say there's Basalt, they're just over the border, on the east end of the county, that there's access to some of those services. So we feel like testing is robust, and as Mason said, is I think that makes it about a third of the population, or 20%, or whatever that number is, that has received testing so far.
And a follow-up question to that is, do we have any free testing becoming available like Eagle and Pitkin counties have?
I was just going to say there's a plan worked on to look at Glenwood High School and some possible free testing in that parking lot with a local provider. It's not been formalized all the way to promote yet, but there's some avenues that are being looked at.
Okay. I'm just going to ask a question that we received earlier this week. Where can we find demographics of people who are dying of COVID now versus in the spring?
So again, people are going to think I'm trying to sidestep a question, but we don't necessarily have that. That's the coroner's data to share. We've only had 6 deaths, which is, I'm not sure what the word I'm looking for is, but, we've only had 6 deaths. And so some of that information, to be able to report things out, the state usually likes us to have 3 or more of a particular set of demographics to report out. And so we don't necessarily have that. All of that information is available if you wanted to contact the coroner. They're not as bound to those reporting standards. That isn't the correct way to say that. They're not bound to what we are as a public health department. We know that there have been no cases of death of people under the age of 30. Unfortunately, this virus does seem to be deadlier for for our older population. And to answer Amy Haddon-Marsh's question in there, they are not. Their reports are public. But you have to ask for them, and you have to have specifics about. So you can't. I'm not sure if Coroner Glassmeyer would just allow you to send an email and say, "Give me all of these files." They might be able to help you with some of the more information. But their reports are not bound by HIPAA.
Thank you for seeing those follow-up questions. I'm really trying to pin my place so I don't miss any of the previous questions, and so therefore I'm missing follow-up questions. So if you guys see those, please go ahead and jump in and answer those. I don't have to mitigate every single step of this conversation. So there was a follow-up question earlier from Amy Haddon-Marsh. And I missed the timing of it, but I think she's asking if you can speak to whether the commissioners will adhere to the state rules if they do direct the state to move to orange, and or to the county to move to orange. And there's another follow-up question that, just to clarify, you didn't say that the county is moving to orange tomorrow. You said that there would be a press release about that tomorrow.
Correct. So they're currently working on a press release from the commissioners, and that should be coming out in the very near future.
And the other question was, can you speak to whether the commissioners will adhere to the state if they are directed to move to orange?
From my position, I can't. So that would be a question for the commissioners.
How do we inform the community of a place to get tested when they have symptoms so that they are not afraid and confuse COVID symptoms with a cold and end up not taking the necessary precautions?
Sure. So I think this kind of goes back to the further questioning about testing availability. And so you do need a provider there are some places that have some standing orders where people with symptoms are able to get tested. Mountain Family Health Centers is a place where somebody can go in and seek that as Josh was talking about, that referral process and really be seen to make sure that there isn't any, that there might not be something else and they may not need to have a test. And so, you know, unfortunately, we don't necessarily have all of the testing answers because we want people to be informed where they can go. I'm gonna look for, there is a website that Eagle County has provided that we're not even plagiarizing, we're just gonna use it. And it's got a list of community testing sites. It doesn't necessarily go so far, it only goes to Glenwood right now, but Mountain Family is the place to go and get tested. And so that, you know, that would be the place, would be Mountain Family, and to make an appointment and to see you know, a provider, and then have them do an assessment and a test.
Thank you, Mason. And again, I think just further clarification, is the county moving to orange on Friday?
So just to clarify again, that the state has responded, and their position is that Garfield County, that the state is classified Garfield County as orange, and that being into effect tomorrow afternoon at 5 p.m. with variances in place. So the Garfield County Commissioner, that's the response from the state that we got, that we can talk to. The Garfield County Commissioners are working on putting out a press release on their stance on that, and that should be coming out. So, I mean, you know, you can report what you like. I think that, you know, it's kind of looking at a courtesy position to look at some of the information that'll be coming out of the commissioner's office and how they're approaching the information and what the position that they're taking with it. So, you know, that's the way it is, and that's where it's at. And so,
So there's a question in Spanish in the Q&A, and Mason is going to try to answer that question.
And so there was a question that was asked, you know, in the questions that you sent us about asymptomatic testing. And this asymptomatic testing isn't recommended for individuals unless you've had a known exposure of a close contact and you've waited 7 days. So 7 days is usually the kind of like that window, right? Most people who are exposed start developing or showing symptoms within that, you know, the 2 days after they were exposed to about 7 days. And so we would highly suggest, if you are an asymptomatic individual and you feel that you need to be tested and you have a known exposure, that would be something to, again, assess with a provider. And so there is asymptomatic testing happening. But again, since we're not a testing site, we leave all of those decisions for the individual to be made when contacting or working with their provider. Great.
And yeah, a recommendation from an attendee, if you're adding Eagle County's testing info on your website, it would also be nice to add Mesa County's info, just because that is so helpful for those of us on the Western Garfield County. And that's all the questions I have. There was a question about cats and whether cats are a vector of transmission of COVID. Can cats pick up, because, you know, they leave the house and they go to their neighbor's house. Can cats transmit the virus?
I have not heard that. I'm gonna let Josh answer that. I just haven't heard that part.
yeah, there, you know, early on, there was some information that came out, or they were looking at that possibility. You know, we got this question. I looked as best I could for updates around cats and them becoming infected or transmission. And I know, to be honest, I wasn't able to find anything other than those earlier on reports. We have heard and do know about mink and other species. You might have heard about Denmark and their calling of their mink farms and those issues and some spread amongst that. So it's a possibility. Like I say, this is a zoonotic disease, and it jumped into humans from somewhere, another species, and it could, and obviously it's jumped into mink, and so that's always a possibility with these types of viruses, is can jump into other species and mutate. But I'll continue to keep my ear open if we do hear of anything that confirms that cats are positive or a transmission source, then we'll make sure and get you that information and get it out to the public.
Great, thank you.
I did go ahead and put a link to Garfield County's testing page on there as well. So that does have that west end of the county and what those sources, along with Mason's east end with the Eagle County.
Great, thank you, Josh. I did see one other question that had come in via email. It's about the phone tracing, and Mason, I think you spoke about the phone tracing a little bit earlier. Do we know how many people in Garfield County, in Roaring Fork region, and Colorado River Valley have that app installed, or what kind of data are we getting from that?
Yeah, and we wouldn't, and it wouldn't, like, you can sign up for it, but it wouldn't even become active unless the individual who tests positive allows for their phone and their data to then be sent. And so there isn't, I don't even know if the state knows how many people have signed up for that. And so that's state level information.
Are there any other questions out there? If any of the attendees have any further questions, now's your chance. And what do you guys have to say about the upcoming holiday? I mean, you've spoken to what we can do, limit contact with people we haven't seen in a while. And, what else do you have to say about the upcoming holidays and limiting exposure?
So sure, that's a great way to put it, Amy, is to limit the risk. And so if you can, the number one thing, again, is to reduce the number of contacts that you have, especially with people who haven't seen for a while. But we know that people are going to gather. And so there are some, the CDC is saying not to travel. That's not going to happen, right? We know that people are going to travel and people are going to want to be around their family and friends. One of the things that could be really beneficial is thinking about all of the steps that it takes for you to get to the place that you're wanting to travel. Are you going to fly? That means you have to go to the airport. You have to be around all of those people. You've got to be, although planes are very safe, where there's definite research showing that planes themselves are one of the safest places because of how much circulation they have and how many, their HIPAA filters and everything like that inside of the plane. But it's all of those steps before and after. And so, think about those things. If there are too many steps for you that could impact your risk level, maybe consider, going another way. When you get to the place, maybe thinking about reducing the amount of time that you're actually in a space with other people. Thinking about ventilation. If you are in a home, maybe thinking about opening windows. If you can't do something outside is probably the best option out of all of these options so far. But if you can't be outside, thinking about how do I ventilate my home by pulling in air from the outside and pushing the air that's inside out. So does that mean you put in a box fan into a window and turn it so that it's going to pushing the air outside? and then maybe wearing masks if you haven't seen people, even if you're inside, right? If you're inside your house, wearing masks if you're around people that you haven't seen before, and people should feel okay to doing that. And those types of things. And if so, there, that would be some of the suggestions I would have.
Thank you. There's a couple questions in Spanish in the chat. I'm wondering if the interpreters can translate those for us.
And while they're doing that, I'll just make a statement about kind of what we're seeing. It really gets down to that mask wearing too. We're seeing some renewed evidence of definitely protects protects others still if you have virus and are potentially to transmit it. But they're also seeing that some benefits to their wearer now as well. So as the science gets updated, we try to keep up with that. But it's just really the mask wearing, even if you're in those close quarters, even if you're around family. I think that's where there's some gaps is small group gatherings that people feel that they're pretty safe because it's a small number of people, but they may be from a mixed households and things. So, that's still a very solid recommendation that we're in as much as you can in most environments, as much as possible. Those face coverings, cloth face coverings are so important with how this virus is showing through the science that it's transmitted.
Thank you. So one of the questions was, is there an opinion on the risk of exposure or transmission through food that other people have prepared, sharing food or meals with others, neighbors, or just dropping it off at their house? Is that risky?
No, we haven't seen any direct evidence of transmission from food, like from someone preparing it. There is a risk. As far as food service and restaurants and things, they're supposed to be wearing masks. So we would recommend, tracking along with those food safety parameters of wearing face covering while you're preparing the food, just for extra insurance. There has been some fecal to oral route transmission, which is very common with most viruses and other germs. And that's why the message about washing hands is so important. So there could be some potentials with handling food and if someone doesn't have good hand hygiene, but we haven't seen a lot of data around that. So we're moving into the Thanksgiving season, right? And wanting to prepare food, and there's so much food insecurity out there, and we know that it's so important. But we have seen some folks that are like putting together, instead of preparing food and taking, say, that to or sharing that, then putting a meal kit together. So kind of a box of and some recipes and putting that in there for folks. Obviously, if people don't have the capacity to do that in their homes or have a hard living environment or homeless or something, obviously that's an issue. But so there's some creative ways there. We have had also looking at what a lot of our nonprofits that maybe have done traditional come in and sit down and have a Thanksgiving meal, shifting those to go type environments or a drive-through. So they're cooking and preparing the food, following food safety protocols, and then so that's good. I think the community is being responsible. You're seeing some of that movement. But I think if you follow general food safety protocols of hand hygiene and face coverings while you're preparing the food, then it should be good with those practices.
Thank you. And there was another question about where can people find financial assistance? Sadly, a person's whole family was exposed and affected with COVID. And thank you, Mason, for putting that link into chat. There's a link. I'm not sure, I haven't clicked on the link yet. I'll do that right now. The Aspen Community Foundation, Aspen to Parachute, list of resources, list of places to find help right now. And then the Department of Human Services as well. Thank you for pasting that link into chat.
And so for that financial assistance piece, you know, it's difficult for me to answer what that could be, just because I don't know the particulars. But I would always. Oh shoot.
Oh, okay. Yeah.
Oh, I just got that message. Jen, thank you for posting that out. I will make sure, here's both of those. Again, I apologize. I didn't know that that was happening. So there are the two links, Garfield County Human Services, and then the Aspen to Parachute COVID. And so what we would really suggest, no matter, you know, a person's situation, is to contact DHS. They have either a list of resources, and they can help direct you to other sources. But that Aspen to Parachute COVID from Aspen Community Foundation is a good resource too. I'm sorry that it's probably all in English. Oh, they have a Spanish Espanol at the very top of the page, so people can access it in the language that they are most comfortable in.
It looks like that's all the questions. Are there any final thoughts before we wrap up today?
I'll add, yeah, kind of my piece that I was hoping to discuss, since I look at the orders and the and the restrictions and things, is on hold. So apologize for where that's at this week, but you know, like I said, that'll be coming out here as soon as possible, so folks can get that and start working on looking at those restricted capacities. But I'd just like to say, you know, we're just promoting safety as much as possible over the holidays, and personal responsibility and approach to wearing your face coverings. And we're asking really just, you know, it's a community level how we stop this transmission, and it takes everybody being diligent and working on those mitigation factors and what we call non-pharmaceutical interventions, which is the face coverings and the social distancing, and reducing your circle as much as possible. And so I like to say we're in it together, but farther apart, you know, through this scenario. And you know, I think there was a good message to look at. Folks are possibly going to go ahead and want to meet with family and have Thanksgiving, and so we're trying to message that on our Facebook, and as Mason said earlier, as much as possible, to say, here's how we're promoting to do it as safely as you possibly can, and to really be diligent about the ventilation and those measures. So just really thank you so much for having this and this continued interface with the community.
Thank you so much, Josh and Mason. There was just one final question that came in. Do you have a recommendation on the type of masks to wear, cloth or disposable? What's your recommendation there?
Yeah, you know, the cloth masks, from what we've seen, are acceptable, and it needs to be a double layer. You know, you want to look at the thickness of the material and the quality when you're judging it. If it's a thinner material and you need that for some flexibility with your work environment, then doubling those layers, having a insert or something like that that goes along with it. It's still recommended, though, if you have access to a surgical mask. You know, very few environments require the N95s. Obviously, the medical community's there, and we're still working to keep those supply chains on the N95s and respirators open, as well as you want to watch on any mask that it doesn't have an exhalation vent on it,
Mm.
or if it does, that there's an extra filter in that valve. You see some with a little valve on it, because really the number one factor of the mask is to, if you're carrying virus and you're not expressing it out, it's stopping it there and knocking it down, those droplets. So if you have that exhaust vent, it defeats that purpose. So just that would be my 2 cents on that. But yeah, the cloth, when the science that they're seeing on that is, as long as it's double layered and thick enough, it should be enough. And so a lot of the homemade people are still making them. And, you know, we look at, we all have different designs, and we've moved into a little bit of a fashion statement with that. And, you know, we try to make it as fun as possible, right? And I think that's what we have to do as a community, is like, how do we embrace it and make it as a part of what we have to deal with here, and as fun as we can there for a while. So.
Great. Thank you so much. Mason, did you have any other final thoughts before we log off?
No, I don't. I think, you know, we've been able to answer, hopefully we've been able to answer some of the questions there. This is always a moving, kind of amorphous type situation. And so just when we think that we have something kind of pinned down, things change. And so, you know, I know that can be a struggle for people. So what I would also suggest is, if you have, something that we haven't necessarily discussed is mental health issues, right? This is tough, and we know that. We have resources available. You know, early on in the pandemic, there was something like an increase of 800% to our Colorado crisis line, and everybody kind of was like, oh, that's not great. And in my head, I was like, well, that's fantastic. That means that people know that that's a resource. They know how to access it, and they're accessing it. And so knowing that your mental health is as important as your physical health is necessary. And so taking a little bit of time to know, you know, maybe reaching out to the Colorado Crisis Line, reaching out to a therapist, reaching out to a friend, and trying to make sure that you're taking care of your mental health is definitely a part of this ongoing conversation.
Yeah. Well, thank you so much. Thank you both. Let's do this again if things change. This is really important for both the library and for Garfield County Public Health, and we're happy to partner with you going forward to get this information out to both of our audiences. So thank you again so much for being here today. Thank you for your time. And thanks to all the attendees. Thank you for your great questions and your engagement, and please spread this information to all your friends and family. The library will be posting this recording on our Facebook page and possibly sending that out in a newsletter, and certainly Garfield County Public Health, please, we'll send you the link to share the recording as well. So thank you so much. Take care, everyone. Stay safe out there.
Bye-bye.
Bye-bye.
You too.